Do you also feel stiffness in your shoulder, either during the morning when you wake up or maybe throughout the day, and as a result of which you might have problems in your day-to-day movements? Well, you might be suffering from frozen shoulder issue, and in today's video, our shoulder arthroscopy specialist Dr. Mukhopadhyay will tell you everything about this topic.
Hello everyone, I am Dr. Mukhopadhyay, a shoulder arthroscopy and sports injury specialist practicing in Gurgaon. Frozen shoulder is a condition of the shoulder where primarily the shoulder becomes stiff. To say frozen shoulder is not a medical condition or a medical diagnosis as such, it is a layman term. The medical condition for frozen shoulder is adhesive capsulitis. It, in a nutshell, means stiffness of the shoulder from any cause. As we all know, frozen shoulder, as I said, is the stiffness of the shoulder. So the signs and symptoms of frozen shoulder are primarily in early stages pain, leading to stiffness or decreased range of motion of your shoulder. The first movement to get restricted is the internal rotation or the inward rotation of your shoulder. As mentioned already, frozen shoulder can have several causes. The most important causes are after an injury, after a particular surgery around the shoulder. Diabetes itself is a condition which predisposes to frozen shoulder. Thyroid, hypothyroidism. Several metabolic conditions in addition to thyroid and diabetes are common causes which lead to frozen shoulder. There are some cases of frozen shoulder where no obvious cause can be found, and those are called as idiopathic frozen shoulders. Frozen shoulder primarily is diagnosed based on the examination done by your doctor, who will evaluate your shoulder to see the range of movement, the amount of pain that you have, and to rule out any other injury, disease or pathology in the shoulder. He can use an MRI to supplement his diagnosis. As already discussed, frozen shoulder is not in itself a complete diagnosis. So in frozen shoulder, we need to rule out any other underlying cause and treat that cause first. The stiffness part of your shoulder may improve with good rehabilitation and physiotherapy. Some patients may require a local injection of a steroid to control the inflammation, and in very rare cases who have not improved over a period of 1.5 to 2 years may require a surgical release. It would not be correct to ask whether frozen shoulder can be prevented or not. As I said, in many cases, the cause of frozen shoulder also is not known. So the only thing that you can do to prevent frozen shoulder is to control the known causes, like prevent any injury around your shoulder. After surgery, make sure you move your shoulder early. Keep your diabetes under check. Keep your diabetes under control. So these are the things which you can control. Despite doing all this, it may not be completely possible to prevent frozen shoulder. If we understand the natural history of frozen shoulder, yes, frozen shoulder has a self-limiting course, but this self-limiting or the self-improving course of frozen shoulder can last up to 2 to 3 years. Majority patients, if we do not intervene, will recover from frozen shoulder with minimal residual stiffness over a period of 2 to 3 years.